We are Team 51 and we propose the Safe Bus Initiative. Current social distancing guidelines recommend a distance of 6 feet between all individuals in a public space. However, maintaining that distance in the blue bus system is difficult, especially while effectively servicing up to 7 million passengers annually. There is a need for passenger flow within the blue bus system to be regulated to provide adequate service while meeting public health and safety standards. We propose a multi-component solution that centers on maintaining social distancing guidelines. The 3 aspects of our solution are reducing the number of bus stops serviced, designating 2 bus routes for medical professionals only, and implementing a ticketing system on popular bus routes. Imagine freshman Billy Magic, who has just moved into his new dorm in Bursley. He is trying to get from his home on North to his chemistry lab on Central. In order to do this, he can navigate to the Magic Bus website or mobile app. From here, he has 2 options for reserving a ticket. The first of these options is the trip planner. This allows Billy to see a user-friendly map as well as input his origin and destination. So let's say Billy enters Pierpont to CCTC. Now Billy can see several possible routes, sorted by how soon they depart. When he clicks on one of these routes, he can view more detailed information as well as reserve a seat on one of the buses. When he reserves a seat, the ticket is automatically loaded onto his M-card, which he can then use to scan onto the bus. The second option Billy has for reserving a ticket is the list view. This gives very similar functionality as the map. He can still input his origin and destination, but he has some additional features, such as filtering by arrival time or departure time. Once Billy finishes his ride, he might want to give some feedback on how his experience was. He will have that opportunity the next time he opens the website or app because he will be greeted with a short 2-question survey. That's great for Billy, but what about people without an affiliation to the university? They don't have M-cards. Well, they can still ride the bus by signing up with their email to get a barcode, which can be scanned to let them onto the bus. The buses themselves will be limited to 50% capacity as per recommendations by the American Public Transit Association. Another benefit of our ticketing system is the ability to contact trace. If someone who has ridden the blue bus notifies the university that they have tested positive for COVID-19, the system would be able to find all buses in the past 2 weeks that a person has ridden and notify all other passengers and drivers of potential exposure. We also propose eliminating some bus stops in order to encourage walking shorter distances. This will help alleviate crowds on buses and encourage social distancing. Since medical professionals use the buses every day to get to and from the hospital, we propose leaving the Med and Chrysler Express routes open only to them with no ticketing required. This provides easier transportation for medical professionals working on the front lines, as well as reducing crowding on other buses. Thank you for your time, and please stay safe.